guys, my name is Summer Lopez. I am a physiotherapist here in Kingston, Jamaica, and we get a ton of back patients who want home exercise programs, and we do give them written programs, but I thought to group a couple programs together on video, I thought that would be really helpful. Our patients have been asking for it, so here it goes, really informal. This is phase 1 of a back care program based on 3 components: stretching, awareness, and then strength or bracing. All right? So I got my little cheat sheet here. So we're first gonna lay down on our mat and we're gonna do a hamstring stretch. So you can use a towel or a sheet. You're gonna take one leg up, one leg out, lengthen your spine, and you wanna make sure you hold all stretches for at least 30 seconds or so. Nice straight knee pulling down on your toes. Taking some nice big breaths. Feeling your spine really nice and long. And then you can switch sides. So as I said, you can use a towel, a belt, anything that you have at home. Good. Just make sure your back isn't kind of flattening into your mat. Make sure you're staying nice and neutral, maintaining the natural alignment of your spine. Good. So that's the hamstring stretch. So all of these are designed to address posture, right? And we're going to do a nice pec stretch. So a lot of us sit a lot in the car or at the computer. So open your arms into a goalpost. And if you're really tight, you may feel that your low back pulls or arches away from the mat. So just make sure that doesn't happen. And again, just stay here, reaching, breathing. You should feel that stretch in your armpits. All right, so this will help you with your posture, prevent your shoulders and your head from going forward. All right, and then we're going to go back to the pelvis. We did the hamstrings. We're going to do adductors now. So there's so many muscles that attach into the pelvis, and if those muscles are tight, it will really affect the angle that the pelvis is at, which will then affect the rest of your back. So this is the adductor stretch. Again, when you open your knees, make sure your back doesn't lift away or press down into your mat. You just hold that nice neutral spine and breathe. Good. So that's adductors. Now we're going to do the abductors, or I call these, our patients call them their back pocket stretches. So make a figure 4 with your legs. Again, your tailbone is nice and heavy, spine is long. So you should be feeling this right in there in that back pocket. And you want to just check that you're not rocked over one side more than the other. You're very symmetrical. Great. So after 30 seconds, you can make your switch. And feel free to hold longer. For simplicity, I'm just running through so that patients at home can get a sense of their level 1 home exercise program for their backs. All right. So we did the hamstrings, the inner thighs, we did the abductors. Now we're going to roll onto the side. Knees bent. If you had a broomstick behind you or a wall behind you, your head and your back would all be in a nice straight line. You can grab your ankle and pull your leg back to open up the front of that hip. Again, make sure you're maintaining the shape of your spine, that you're not letting your belly or your ribs stick out. So just hold it there. That's a lovely stretch. Again, sitting, if we sit, this area gets really, really short and restricted and can really alter the way our spine moves. Great. So let's try that on the other side. So rolling over. Good. Just taking a little time to get organized. Head, thorax, low back, all in a nice straight line. You can grab. Good. So as you do that, make sure your tailbone doesn't stick out. You're maintaining your alignment. Great. So that brings us to the end of our stretching phase. We're now going to go into our awareness or our posture phase. So we're going to come up into kneeling, right? And we're going to work on not being kind of slumped that way or really elevated sternum, just somewhere in the middle. We're going to take one foot out in front. And again, again, just get a sense of being here. Want your ribs over your pelvis, your head over your shoulders, and just hold it there. You're gonna feel a nice little stretch in there. If you don't, you can, we call this our grilled cheese at work. You can press your sacrum forward a little. We never wanna say the word tuck. Press the sacrum forward, pull the ribs in, and I feel that nice opening through the anterior thigh. So after about 30 seconds or so there, we can switch sides. All right, so this is also a little balance work as well if we're not accustomed to being in this kneeling position. So the ribs pull in, the sacrum slides forward, and we just focus on getting nice and tall. Couple breaths. Great. All right, so let's see what's next. Diaphragmatic breathing. All right, so we can actually use breath to move our spine, right? Because when our ribs move, our spine will move. So you can put one hand above your belly button, one hand on your belly button, and just relax. When you inhale, you should feel both hands rise, and then as you exhale, you should feel both hands fall. And again. Couple more big breaths like that. So we're looking not to have the breath happening here. You know, that accessory breath will actually do the opposite of what we want it to. We want the breath to be here in the belly. Great. So then we're going to go into bridging, all right? So we could articulate and move the spine, but for the purpose of today's session, we want to keep the shape of the spine the same. All right, and we just want to reach your knees over your toes. But really get that feeling of reaching long. Good, make sure you have a little space behind your neck, and then land in that same shape. All right, so as we move into phase 2 and 3 of this back education and training, we can do single leg, but again, today is just the most basic setup. And keeping the shape of the spine, lowering it down. Let's do 2 more. Good. So again, feel that knees reaching over toes, trying to create a straight line from your shoulders, through your hips, through your knees, and take it down. Good. One more time. Reaching up, getting all of those spinal stabilizers to start to kick on. Great. All right, so let's just check and see if that's the end of our awareness. Let me take a look. All right, oh, seated weight shifts. I'm gonna go over to the chair really fast. Let me just grab it here. Okay, so sitting is a problem for a lot of our back patients. So you can use a little weight, maybe anywhere between 5 to 7 pounds. When we sit for these weight shifts, we want to have a lot of weight through our feet. So if my bum is all the way back here, I don't have a lot of weight through my feet. So I want to get at least half of my thigh off of my chair. I can sit with a nice wide stance. You know, I can use my weight to shift back and forth, or if I don't have a weight, I can put one hand here, one hand there, very similar to the tall kneeling. And I can just start to get a little weight shift going, right? So I want to learn to initiate from my hips and not my spine. I can stagger my feet and do those same weight shifts. And again, the key for back education is redundancy, repetition, repetition, repetition. So the more you can do it, the better you'll learn it. All right, so that's your weight shift. Great. So that's the end of our awareness. Let me just get rid of the chair. So last but not least is our bracing. That's our strength. Okay, so I'm gonna go back down on my mat. I'm gonna get my nice cushion here just for a little head support. So patients who've had a lot of back pain, when we have pain, the nervous system forgets to stimulate strength. So we need to reteach how to stabilize. So I'm just gonna use, again, getting into neutral spine. I'm going to bring this leg up to tabletop. I'm going to hold right here because I want to feel that this gets really hard and firm, and I'm going to try to press my leg away with my hand, and I can feel that that fires up really, really well, right? And I can feel that, you know, I'm having to focus on maintaining the shape of my spine. Great, so let's try that on the other side. So now I'm feeling on this side. I'm going to try to push this away, holding strong. Good. So I'm a little weaker on this side. I got a little shake going here. Nice. So now that I understand that, I can come up to 90, and I can do both at the same time. I can try to hold an isometric hold for a couple seconds. Make sure you're not holding your breath. Make sure your spine isn't lifting away from the table, or the mat rather. Good. If you want to make it a little more interesting, you can go diagonal. Right, so this, believe it or not, is a lot of work. Good. So once you really have a good understanding of that, then you can go into what we call level 1 dead bug. So this is what we teach our patients who need spinal stability at the clinic. Good. You can go heel first, you can go toe first, you can take the arms up. Good. All right, so that's bracing, and we have one more, a wall squat. I'm going to come on up. Actually, two more, a plank. Okay, so the beginning phases of a plank. So quadruped, hands and knees, shoulders over wrists, knees and hips aligned. I'm going to take one leg back, nice and straight. That same bracing that I just taught myself, I'm going to get that all active. And the other leg, hold, and then I can go back to my kneel, and I can alternate. 1, 2, 3, 4. 1, 2, 3, 4. And as my endurance improves, I can hold that plank for a longer time. So just make sure you're not doing that, right? We want a nice neutral spine. Great. So here's the wall squat. I've got to go in there to find a wall. So part of a strong back means you have to have strong legs. So you want to try to get yourself into a 90-degree position at the hip and the knees. Good. Again, same neutral spine. And your goal is to be here for a minute. Just taking some nice deep breaths and watching the time slowly pass for a minute. All right, so I hope that was really helpful. We're going to put it on our YouTube channel. And if you have any questions, we're at BodyForte Physiotherapy Pilates in Kingston, Jamaica. So hope that was helpful. See you soon.